Good afternoon, everybody. Good to see you. My name is Carla Sumala, co-director of the San Francisco Tech Council with my colleague, Andrew Broderick. We're going to talk about the Lifeline pilot program. And we have some guests here from the CPUC who are going to provide the details, eligibility, what this whole program is about. We have Loy and Shari from the CPUC, and I'll let them further introduce themselves. Why don't we go ahead and get started?
My name is Loy Nguyen, one of the analysts with the Lifeline program. And Shari Ward is one of the supervisor in the Lifeline program. This is an overview of the Lifeline program. The Universal Telephone Service Act of 1984 established the California Lifeline. The California Lifeline program provides a subsidy to eligible low-income households for communication services, which includes wireline voice over internet protocol, also known as VoIP, or wireless services. The minimum service standards and specific support amount for the wireless plans include the basic plan, which offers a monthly data allowance of 4.5 gigabytes with a usage allowance of 1280 gigabytes, data usage allowance subsidy up to $19. For wire plans, the minimum service standards and the specific support amount for the standard flat offers telephone service and a subsidy of up to $19. For the bundle, which is voice and broadband, offers 25 megabits per second data allowance of 1280 gigabytes and a sub of up to $19 per month. Now, the program eligibility, which it will be the same for the pilot, to qualify for California Lifeline, applicants must meet either program-based or income-based eligibility requirements. Program-based eligibility is at least one member of the household must be enrolled in a qualified public assistance program, such as Medi-Cal, CalFresh, Supplemental Security Income, or other similar programs. For income-based eligibility, households' annual gross income must be at or below levels as shown in the table provided, which are set at 150% of the 2025 federal poverty guidelines. Okay. On August 28, 2025, the Commission approved a 3-year voluntary home broadband pilot program that is technology neutral. This pilot offers a subsidy for either standalone broadband service or a bundle service that includes both broadband and voice. Eligible consumers can apply their California Lifeline subsidy to any internet plan that meets the established minimum service standards. There is a standalone broadband, offers a monthly data allowance of 100 megabits per second download and 20 megabits per second upload speeds, the data usage allowance of 1280 gigabytes and a subsidy of up to $20 a month. Bundle plan option combines voice and broadband services, providing a monthly, the similar minimum service standards of 100 megabits per second and data usage allowance of 1280 gigabytes and a subsidy of up to $30. Now, there are 2 exceptions to these minimum service standards. One is if there are areas within the provider's territory where they cannot meet the 120 megabits per second service, which at that time they would ask for that exception as outlined in the decision, where they would provide a map of their territory. The second exception is any low-cost plans for income-qualified individual, where the minimum service standards for those low-income plans that are lower than the established minimum service standards, but that provider can also offer other plans that meet or exceed the minimum standards. The CPUC continues efforts to close the digital divide and improve broadband affordability through the California Lifeline home broadband pilot program. Our objective is to increase both provider participation and overall enrollment in the California Lifeline program. We have two key milestones. January 2026 is the official pilot launch date. This pilot launch date is applicable to current California Lifeline service providers and any service providers with commission-issued certificate of public convenience and necessity or wireless ID registration. We also have another milestone, which is anticipated for the Q1 of 2026. We will be issuing guidance through a resolution for non-CPCN or WIR entities. This guidance will outline how these non-CPCN WIR entities can register and participate in the pilot program. How can service providers participate? For current California Lifeline or commission-issued CPCN or WIR providers, they can file an advice letter that includes the required information as specified in the decision 2508050. I know it's a lot of information, so we will take any questions you may have.
So, how can we find out which providers are participating in the pilot?
Great question. Right now on our website, our third-party administrator who we work with, they are updating our website. So as we are getting advice letter from providers and approving those advice letter, their name and information will be on our website. Consumers can check to see which providers are available in their area.
We've got a question from Jen asking if there are any flyers on this pilot that can be distributed to constituents.
So we generally don't do outreach in the program. We rely on the outreach team at the PUC and service providers to do the outreach to their customers.
We've got a question from Willie. Why don't you jump in, Willie?
Sure. I need help understanding the 6 gigabyte versus the 1200 something allowance. Is it 6 gigabytes per month?
Sure. 6 gig is the data allowance and the 1280 is the usage allowance.
Hi, Kevin Ortiz from Monkey Brains ISP. Just a quick question. We're planning on actually applying to be a provider for the California Lifeline program. And I was wondering, how long does it take in terms of the approval process for the advice letter?
So the advice letter, so we comply with General Order 96B, which is give the public 20 days a protest period. The CPUC have 30 days to make a determination. If there are additional information that's needed, we can suspend it for an additional 180 days. But in the meantime, within that 30 days, if there are missing information or we need additional information, we will reach out to the providers for the additional information.
I just have a question in terms of how folks in our communities can use this. Do they have to go through a provider to get this, or can they go to your website and apply?
They would have to go through the provider. We have a website they can go on. Right now, the only information we have is for wireline and wireless service. So the pilot, because we're still waiting to firm up the internal process and receiving advice letters from providers.
What does it mean to be a provider?
So currently in the core Lifeline program, you have to have a CPCN or WIR, which means you're a telephone corporation.
Okay.
So for those ISP or broadband providers that do not have a CPCN, they can apply to get a CPCN, WIR, or if there is an affiliate that they have a partnership with or part of a company, they can become an affiliate with a CPCN WIR holder.
In terms of a process for folks on this call, they would need to go to the site, the provider search, and figure out who in San Francisco City and County who is a provider, then work together with that provider.
Yeah.
Okay, and Kevin from Monkey Brains, good to have you here. You're saying Monkey Brains is hoping to become a provider and will make this application.
Yes, we are planning on filing an advice letter to be approved as a California Lifeline provider.
If you don't know yet, participation in the Lifeline program from a provider is voluntary. We don't force providers to participate in Lifeline. Subscribers can encourage their service providers to participate in the program. We can't force providers to do that. So what would happen essentially is if you don't have a provider in your area and you fall and you qualify under the low income qualification for Lifeline, you will not have access to this if you don't have a provider that offers, that offers the services.
Great. Lloyd, you have the minimum service standards.
So this is the speed and this is the usage.
I just have a question. You call it a pilot. What are you piloting? You said the goal is to increase providers and participants. Over 3 years, what will you be tracking? What decision will be made at the end of 3 years as a result of the pilot?
The reason it's a pilot is because currently the Lifeline program cannot offer home broadband. The MORE Act is very specific in that there needs to be a voice component. Since the sunset of ACP, we realized there is a need for broadband. Hence a pilot program. What we're trying to figure out is there really a demand for broadband service from the low income community? And if that is the case, before we can permanently offer broadband, we would need to make changes to the legislation. Right now, we can only offer voice services. We wanted to expand the program by allowing bundled services, but there is still the need to offer the voice component. Does that answer your question?
Yeah, that really helps clarify. Thank you.
I was just thinking if you could give us an example of, let's say, a service ISP provides internet service, broadband service is $70 a month. If you qualify for and you're eligible for this service, what does that mean? Can you give us an example? Hypothetical as it may be.
So if the retail offer for standalone broadband that meets the minimum service standard is $70, the $20 subsidy would be applied to it, then the cost to the consumer would be the $50, the remaining balance.
So are there two applications then? One for CPUC and one for the service provider?
No. So you would contact the service provider. They will work with the TPA to confirm your eligibility. And if you're approved, then you're approved. So there's no separate process to go through.
The billing statement is between the customer and the provider. We do not work directly with the customer. We work with the provider. The provider will either discount the customer or reduce the price, right? They can do it either way. But what happens is we then, at the end of the month, the provider provides us with the claims. They're going to provide us with the list of customers with, I believe we have some reporting requirements included in the decision. And then we pay that amount directly to the provider.
We had Cynthia next and then Chester. Cynthia, go ahead.
My question is, I understand there's a $20 credit paid directly to the provider. Does anyone have a sense of the least expensive net cost to our participants for monthly broadband?
The answer is no, because communications in general is a deregulated industry. Prices are all over. A plan can cost, a 6 gig plan can cost from $19 plus $1 for additional data to $19 plus, I don't know, $10. It's all over the place. It's because it's a deregulated industry.
Thank you.
Chester.
What we have is that in previous decisions specific to Lifeline, which may apply to broadband, in a 2020 decision, the commission decided if, however, there is a copay, if the customer is going to be paying out of pocket, what we're requiring the commission to do, or Lifeline in general, is to put together some sort of affordability analysis. Now, Because the plans are all over the place. What we're trying to do now, and this is again just for Lifeline, which I'm hoping is also going to apply to broadband in the future, is right now what we're establishing new minimum service standard requirements with specific support amounts associated with it, but still at the same time, hopefully being able to provide the provider with the flexibility to make any adjustments beyond the minimum service standard requirements that we will be establishing in new service standard requirements that we will be establishing in the future.
Chester, jump in.
Will you guys stand behind your providers? Or is it simply the arrangement that you've made? Because, I mean, there's been some history of providers who have not done what they said they were going to do. And that's the concern that you're going to get with a lot of people that I hear in the community.
We established the minimum service standard requirements they need to fulfill if they want the subsidy. Oftentimes we get complaints. When we get complaints, we investigate. If we can't come up to a resolution, we refer this to our enforcement. So in answer to your question, we do protect consumers. We have consumer protections and service quality in place at the division.
I wanted to ask about eligibility. We've heard from the community that Lifeline was difficult and time consuming to apply for.
The good thing about CalFresh is that it automatically qualifies you. So you're in their database. So what happens with Lifeline right now is come renewal, the first thing that we do, the first thing that the administrator does is all participants go through CalFresh, whether you came in through CalFresh or not. If you're in the database, you're automatically renewed. We're also establishing a way for the consumer to come directly to the website and apply through a portal. Instead of going through the service provider or the service provider's street teams, we go through them as they can go straight to the website and apply. The challenge is we cannot favor one provider over the other. If you have 5 providers in an area, we can't say go to provider number 1 because it's not fair to providers, right? So, but I think currently the TPA has a way of providing the customer with all the providers that are available in their area.
Could you say what TPA stands for?
Third party administrator.
Great.
Are you doing any cross-marketing, thinking of streamlining outreach through public assistance programs to do the kind of promotion and marketing about this in ways that not just the CBOs or nonprofits in the communities are left to kind of try and drive consumers into the pilot?
We do not have the budget to do marketing right now. So what we do is we rely heavily on our providers to do the marketing themselves.
With CalFresh, we have a partnership. They provide a link on their website to our website. So, so that's one, but that's what we're also trying to expand. So other public assistance program that could align with our, refer to our program too.
One more question, practical question. If a customer, we have many participants who only use their smartphone and access the internet through their smartphone. So it's a wireless service. Now, if they're paying, let's say, $50 to T-Mobile, and they are a CalFresh customer, they are eligible for the discount, and T-Mobile is part of your partnership. They are eligible to receive a 20% discount.
That would be our core Lifeline program. So it would be a wireless program. So if the provider that you are with is a Lifeline participant, a service provider, then you would receive up to $19 of subsidy. Enter your zip code and it will provide you a list of providers that offer either wireline or wireless service in your area. You can reach out to them and say, I'm interested in becoming a Lifeline participant.
Did I hear you say everyone goes through CalFresh to become eligible?
No, during renewal, because there are several ways of becoming eligible for Lifeline. It's not
Right.
limited to CalFresh, right?
Right. Okay.
There are programs like WIC, for example.
Right.
But when we do the renewal, which is after a year, during your anniversary date, because CalFresh automatically qualifies you, everyone goes through CalFresh first. If you're in their database, you're automatically renewed.
Sure.
That's for the current program. Now, the eligibility for broadband is the same. We've
Right.
decided to keep the same eligibility requirements for the pilot.
I just have one last question for Loy and Shari. Is there a goal in terms of a number of individuals that you're hoping will sign up for this benefit to make this pilot worthwhile? Or do you have targets you're trying to reach?
The goal is to match the ACP participation. Now, mind you, the ACP eligibility is far larger than Lifeline. So there were people that enrolled in ACP that quite honestly do not qualify for the Lifeline. The goal there is to try to match the ACP numbers. And I have the answer to your question. It's Medi-Cal. However, we have limited access to Medi-Cal. And the reason for that is because DHCS has concerns about HIPAA.
This has been a great conversation and you've helped us so much, Loy and Shari. This has been super helpful.